In this video, we will be discussing relation of age and unintentional weight loss, as well as treatment modalities. So let's begin with the age. Progressive decline in body mass, 0.1 to 0.2 kg per year, usually occurs in association with normal aging process. Beyond this normal aging, elderly patients are more prone to present with clinically significant weight loss. Research studies have shown increased mortality rate among patients older than 65 years with the unintentional weight loss. Now we will be heading towards treatment strategies. The treatment modalities should be targeted to primary disease, which is the culprit of weight loss. Baseline investigations are repeated if no diagnosis is reached, and problem of weight loss continues. Blind computerized tomography of the abdomen and pelvis is performed without clinical pointers. It often leads to some diagnosis as well as excludes possibility of numerous neoplastic lesions. Let's discuss another strategy, which is nutritional support. Optimized food intake, oral nutritional supplements, multivitamins can help to cope up with weight loss. Nasogastric tube feeding is another option for patients who cannot have oral food intake. Additionally, we can go for therapeutic trials. Use of steroids to treat underlying inflammatory condition is justifiable in few elderly patients. Antibiotics are recommended if there is a suspicion of tuberculosis or any other infection. Regular exercise is recommended for elderly patients because it stimulates appetite as well as keep the body active and healthy. Last but not the least option is use of appetite stimulants such as magistrol acetate and dronabinol. They can cause weight gain. However, most of them have significant side effects in elderly people. That was all for now. Get yourself equipped with more information on one and only sqadia.com.